Hello everyone, this is your student nurse Administration-Escovilla, and for today's video, I am going to perform the parenteral drug administration. Return demonstration. Parenteral drug administration refers to any method of administration other than the oral means. However, it is most commonly associated with injecting straight into the body, bypassing the skin and the mucous membranes. The most common routes for parenteral administration includes the intradermal, subcutaneous, intramuscular, and the intravenous routes. Now, in performing medication administration, it is important to remember to observe and perform the 10 rights of medication administration to ensure patient safety and ensure that we give our clients the most appropriate care. Now, for this video, I'm going to perform the 3 skills which will be divided into the 3 scenarios. The first scenario will include the medication administration through the intradermal route, and the second scenario will include medication administration through the subcutaneous route, and the third scenario will include medication administration through the intramuscular route. Now, these 3 scenarios have the same preparation phase, and so I am going to perform it at once to avoid making this video unnecessarily long. So now, I'm going to begin before we actually proceed with the actual administration of the medication to the patient. The first thing we would want to do is to check the doctor's order and the medication administration record. This is done so that we'll have to be able to identify what drug is to be given to the assigned patient. We have to determine the drug's name, the dosage, and the route of administration, and the time it is to be given. So now, after doing that, we also have to check the label of the medication against the medication administration record to ensure that we are going to prepare the right medication. So now, in medication administration, it is important to perform the 3 checks. The 3 checks. We'll have to check or read the label of the medication when it is taken from the medication card. We'll have to read the label again before withdrawing the medication. And so after doing that, we'll have to proceed with the preparation of the equipments needed to conserve time and energy. The equipments include the syringes. I have a tuberculin syringe. I have my insulin syringe and a 5cc gauge 23 syringe. I have my alcohol. I have my alcohol. I have my sterile water, which will serve as medication for this demonstration. I have cotton balls soaked in a 70 alcohol, and I have my waste receptacles over here. I am going to proceed now with the preparation of the medication. Now I'm going to proceed with the preparation of the medication from a vial. So before I do that, I'm going to perform hand hygiene to observe appropriate infection prevention procedures. So if the medication still needs to be reconstituted, the vial would contain the powder form of the medication, and a diluent must be added into that vial. After adding a diluent, we must mix it thoroughly by rubbing the vial in between the palms of both our hands. Now, after doing that, I'm going to prepare the syringe. I have here a tuberculin syringe. This is ideal for the skin testing and intradermal injections. So I'm going to open the packet. It is important to remember that we can only touch the barrel and the plunger of the syringe to avoid contaminating the needle. Now, since this comes with a needle already, I'm going to loosen it up first so that I can connect my syringe into an aspirating needle. And I am going to open the aspirating needle and then connect to the barrel into the aspirating needle. Ensure that the connection isn't lost. and then I'm going to set it aside first. I'm going to open the covering of the vial. Then the rubber seal is then exposed, and so I'm going to clean it up using cotton ball soaked in a 70% alcohol. Now after doing that, I am going to get the syringe and cup, and then do I'm going to draw air into the syringe, then amount the air will be equal to the amount of medication that needs to be administered, and then I'm going to push the air into the vial. So pushing air into the vial will prevent a vacuum from forming, and if you put too little air, then you will find it hard to draw out the medication. And if you put too much air, then the medication might be forced out to the syringe. So I'm going to invert the syringe and draw the exact amount of medication needed. So now I'm going to invert the syringe and draw the exact amount of the medication needed. And after doing that, if you see air bubbles inside the syringe, we can lightly tap the barrel to expel the air bubbles, and then I'm going to remove the aspirating needle to avoid needle break injury. I'm going to connect this barrel now to appropriate size needle. Okay, I am going to place this syringe with the medication into the hypodermic tray. Um, and I'm going to write the medication ticket so that we won't forget what medication it is, the dosage, and for who it is assigned. So now I'm going to proceed the preparation of medication in an ampule. So since we don't have ampule right now because the pharmacist I went into would not let me buy one, so I'm just going to improvise. So what I'm going to do first, I'm going to prepare my syringe. So I have here my 5cc gauge 23 syringe for my intramuscular injection. I'm going to open the packet. And since my syringe comes in with needle, I am going to loosen it up first so that I can connect into my aspirating needle. So aspirating needle will help reduce the risk of having glass inside into the medication. So I'm going to connect my syringe into the needle, make sure that the connection isn't lost. So I'm going to connect this. Um, I'm going to set it down first. So with an ampule, with what would want to do is to afflict the upper stem of the ampule, and a couple of time first. After doing that, we're going to get gauze or a cotton ball. Hold the cotton ball in between the fingers and the neck of the ampule, and then break the ampule away from you and away from the other people. Um, so just for caution, okay, going to get our syringe. Then I'm going to draw out the medication now. I'm going to recap the needle so I can take um the aspirating needle off. And then discard the aspirating needle into the sharp container so that we can avoid a little break injury, and then connect the syringe into its right size needle. I'm going to place into the hypodermic hypodermic um, tray, and then um, going to write the medication, right? the I'm going to write the medication ticket. Now, I'm going to do the intradermal medication administration. Intradermal administration is the introduction of a small amount of solution into the dermis or the layer beneath the epidermis. Now, we'll have to select the site for injection. It should be 3 to 4 finger widths below the antecubital space and one hand above the wrist. We should avoid using sites that are inflamed, tender, swelling, and has lesions. You'll also have to apply clean gloves. After applying clean gloves, we'll have to clean the selected site for injection using a cotton ball soaked in a 70% alcohol, and then start in a circular motion, and starting from the center going outwards. After doing that, we're going to get our syringe and prepare it for injection. So we'll have to remove the cap of the syringe, and then if there are air bubbles, we can tap the barrel to remove the trapped air bubbles. And then um we should hold the syringe between our thumb and four fingers, and then hold it almost parallel to the skin surface with the level needle up. We also have to stretch the skin. So now I'm going to advance my needle into the patient's skin and then push the medication in until a wheel will form. The appearance of a wheel indicates that the medication has entered the area between the intradermal tissues, and that the medication has been correctly placed, um, that in the dermis, now we'll have to remove the um, dermis. Now we'll have to withdraw the needle the same angle it was inserted to minimize patient discomfort and minimize damage to the tissue. Now we're going to discard the needle into the waste receptacle, and then we're throw a going to draw a circle around the wheel. We should use a blue or black pen because a red pen will interfere with the reading. Now, for the subcutaneous injection, we still have to select the site that is free of lesion-free, of tenderness, swelling, or lesions, and then we'll have to apply clean gloves. After doing that, we are going to clean the selected side, and I'm using an antiseptic swab starting from the center going outwards, and then we are going to prepare our syringe for the injection. So uncap the syringe, pinch the skin hold syringe as if you're holding a dart, and then select the medication the patient into the patient. So we're going to inject the needle at a 45-degree. And then I'm going to release the pin skin, then support the syringe, and then um, support the syringe, and then push the medication, and then doing that after doing that, I am going to remove the needle same angle at it was inserted. Now, if bleeding occurs, apply the pressure to the site with dry sterilized gauze until it stops, and then we have to dispose the used syringe into our waste receptacle. So now I'm going to proceed with the intramuscular administration of the medication. Intramuscular administration is the introduction of the medication deep into the muscle tissue where there is a large network of blood vessel that can absorb the medication readily and quickly. So now for the intramuscular injection, we have to select the site that is free of lesion, free of inflammation, swelling, and tenderness, and then apply clean gloves. After doing that, we'll have to clean um, the site of injection using an antiseptic swab, starting from the center, going outwards, and then discard the use antiseptic um, antiseptic swab. After doing that, we're going to prepare for injection. We are going to get our syringe, hold the syringe using our dominant hand, using as dominant hand as if holding a dart, and then using the Z-track method, you are going to advance the needle into the patient's skin. So we are going to advance the needle at a 90-degree angle. After doing that, we're going to aspirate, see if there is blood. That will appear on the plunger. If there is, we are going to remove the needle and discard the syringe and get a new one. If there is no blood, then we can insert the or we can administer the medication steadily and slowly. So now, we're going to remove the needle from the patient's body, the same angle it was inserted, and then apply pressure to the injection site, then discard the syringe into the waste receptacle to avoid needle break injury. So after doing the procedure, discard the gloves used to perform the aftercare of the equipment and proceed to the documentation process of the procedure done.